Hi, I'm Dr. Adam Considine, and today I'd like to talk about a condition that we see commonly in our chiropractic office called acute cervical torticollis, also known as wry neck. Torticollis is one of those conditions that's caused by a spasm of your neck muscles, specifically the sternocleidomastoid muscle, which is on the side of your neck. And it's usually one-sided spasm. So when this muscle spasms on one side, it causes that head tilt, and that is very uncomfortable for most people. In our office, when we assess for torticollis, what we're gonna do is we're gonna start with a range of motion and orthopedic test. We're gonna do this to assess the motion of the neck and to rule out more severe situations like nerve compression or herniated discs. X-rays are sometimes needed for torticollis just to rule out those conditions. And then after we do the X-rays and the orthopedic tests, then we'll get started with some treatment that involves chiropractic adjustments, soft tissue work, and then we'll give some at-home exercises to help relieve the muscles. With treatment, torticollis is a condition that typically resolves within a couple weeks, and is usually even quicker than that if we can catch it really soon. So if you have woken up with a stiff neck, feel free to give us a call and we'll help.